Hi friends, welcome to Shiao's weekly note. Today we're going to talk about the lower back pain. This is a huge topic, but today we're going to be more specific, talking about the lower back pain that is caused by the hip. 3 weeks before, I had a case. This patient is also my friend. He's a medical doctor. I believe he's a radiologist. He came to me saying, Shiao, I have a sciatica pain on the right side that's radiating down from the lower back to my leg, to the hamstring area. I said, okay, let me check. So we did a short evaluation, and I found he has a very stiff hip on the right side. And with the palpation on the piriformis, it's tender and stiff. So I decided to loosen up the hip, and then I did some stretching and strengthening of the right hip. Even without touching the lower back, it feels much better in one session. I believe after a week or two, he's still training, doing exercise without issue of the lower back. So today I'm going to present what you can do other than the soft tissue mobilization, the massage, what you can do to improve your lower back pain that's caused by the hip issue with some exercise and stretching. Alright, now let's take a look at how to do an easy, simple test to see if you're having a stiffer hip. It's easy to test. Just try to find the table to lay down and keep your leg flat on the table. The first thing you want to do is see you try to raise up one hip without moving the pelvis, without moving the other leg. Say I'm raising up my right leg, so my left leg should stay flat, static on the table without being moved. So go there, go all the way until I hit end range. I try to put my hand there as a mark, and try to put my left hand at around the same level to see, so I can compare. And remember, when you raise up the leg, you should not have any rotation, but it should go straight to the spot. You don't want to turn the hip and go up, because you can go probably a lot more by doing that. So remember, go straight, bend the knee, and to the end range. Okay, now I'm putting my left hand at around the same level. Now I have my right leg go back. Now I try the left. See, when I go up, actually, my left side is probably more than half an inch away from the mark I just put. So that means my left hip is stiffer. That means if your symptom is on the left side, and if you have a left side stiffer hip, that means your lower back pain might be from the stiff hip on the same side. Next part, let's talk about how you can improve your lower back pain by loosening up your stiff hip. The first exercise we can do is try to get on your hands and knees. When we're in this position, on your hands and knees, all fours, try to keep your spine in neutral position. Ideally, you try to tuck your belly in. So during the movement, you're not supposed to flex or extend your spine. Okay, suck your belly in now and try to sit back to your heel. So in this process, you're trying to flex your hip and learning how to stabilize your lumbar spine without moving it. So go back and forth. You can have someone stand behind you to see if you have any rotation of the pelvis. Ideally, the pelvis should stay static without rotation. The lumbar spine should stay static without flexion or extension. You just go back and forth. Try to feel the hip movement. That's the first thing you have to learn. Let me demonstrate the round movement. A lot of people might do this. They go like this. That means they're overusing their lower back, which might be the cause of your lower back pain. So try to learn how to stabilize your lumbar spine when you move and flex the hip without moving the spine. So the second step, we're going to learn how to bend forward properly. if you check me from the side. I'm going to demonstrate the correct movements first. There's a study shows when you bend forward, if you start to bend your lumbar spine before the hip bends to about 60 degrees, you're having a higher chance of having lower back pain. So the proper movement would be like this. So you flex your hip first to a certain degree until you cannot flex anymore, and then you start to bend the back. When you come back, it's the same sequence. You move your hip and then your spine. That way you can minimize the pressure adding to the lumbar spine. Let me demonstrate one more time. When you bend forward, when you come back, the hip always move first, the hip flex first, and then the lumbar spine. When you come back, the hip move forward and the lumbar spine. As you can see, when I bend forward, it's actually the movement that hip goes backward. And then now I start to flex my lumbar spine. When I come back, it's actually my hip moves forward, and then it's my lumbar spine. So that's the proper way to flex your back, to bend forward. Now I'm going to demonstrate the wrong way, not preferred way to flex your back, which is you go with your back first and you go with your hip afterwards. When you come back with your spine and then your hip. If you reverse the sequence, you're overusing the back muscles, which is greatly increasing the risk of having a lower back pain. Okay, now we're going to talk about some supplemental exercise to help to increase the range of motion of the hip. The first thing you can do actually is called pigeon stretching. In yoga, it's called pigeon stretching. So let me demonstrate by facing that way. So get to the O4 position and try to prop up. And see, I'm going to stretch my left side. So I move my left foot in front of me and try to come back down to sit. You feel the stretching already over here. And try to look at your belly button. Make sure the belly button is facing straight down. It's not deviating to the side. And as how much you can tolerate, and try to prop down and try to put the buttocks on the floor. And in that position, trying to breathe. Take some deep breaths. Maybe hold for 5 breaths or 6 breaths according to what you can tolerate. Never force yourself. You don't want any kind of injuries. Right side, same thing. Prop up, put the foot in front of you, and try to drop down to put your buttocks on the mat, and then try to lean forward as much as you can. This is stretching the buttocks muscle. And then the next one, what you can do is to sit and then put your feet together, do some butterfly stretching. Bring your feet closer to yourself as much as you can. Keep your back straight and lean forward, and then start to move your knees up and down to feel the stretching on the groin area. See the next one, what you can do is try to bring your knees apart and try to have your toes pointing out. Get your elbows down. If you haven't feel the stretching already, you can move back and forth, trying to figure out the position that you can get the best stretching of the groin. As for the hip, see, in all these movements, you try not to move your lumbar spine and just moving your hip just to a different angle, to different directions. Next one, find something that by your side which is stable you can use for balance. Get on your knees and try to move back and forth. See, without moving the back, without moving the lumbar spine. You're trying to move the hip. Go forward, go backward, go forward, go backward. Okay, you can warm up like that, and then you can keep your back straight and try to stretch. See, without bending the back, I cannot straighten my knee. But see, in order to straighten my knee, my back has to compensate by flexing, right? That shows the relationship between the fascia over here and the fascia over here. It's like a rubber band. You know, when you try to pull the rubber band, it's always the lighter one, flex first. But we have to train to make your back a little bit stiffer compared to your hip and your knee. So the back will not over move or moving too much during the flexing movement. Okay? Okay, if you have a hard time getting down to the floor, you can always do the same thing. I mean, try similar things with a chair or any surface with a proper height. So see, for example, still I'm going to stretch my left side. So I put my left foot there. First thing, same thing. Try to put your left foot there without bending the back. Go back and forth, back and forth, back and forth. Try to move the hip. Also, you can put your hand on something stable to keep your balance. But go get back and forth. See, try to feel. See, when I go to the end, I can feel the stretching there, but without moving my back. You want to make your back relatively stiffer compared to your hip and your knee. It's always the smaller joints you want it to move a little bit more. Or the mobile joint like a hip, you want it to move, but the spine, you don't want it to move too much. Okay, you can also put your foot there. Now you practice how to move the hip. See, it's just the hip only. I was moving the hip and the knee together. Now I'm moving the hip only. But I think you need to practice both, knee and hip, because the muscle connecting the hip to the knee is also affecting the movement of the hip joint. But remember the principle, you don't move the back. You keep your back straight. Go with your breathing. Breathe out. Breathe in. Breathe out. Breathe in. Okay. I think that's pretty much the content for today. The things I want to say is actually quite easy, quite simple. That means if any part of the body is moving too much, you have a higher chance of problem over there. If you think the fascias are like different rubber bands, but they tied up together, when you pull the whole thing, it's always the rubber band with lighter resistance will get pulled more. So remember the principle. For the lower back, I think because we are working nowadays a lot in sitting. You know, in sitting, you're not moving much of your hip. See, you're bending forward, you're doing this, doing that, you're moving your back a lot. I think that's the major cause, major reason why people are having a stiffer hip compared to the lower back nowadays. So the way to reverse it is to educate, to teach yourself how to move your hip more than your lower back by doing those movements and stretchings. And remember, if you don't feel a significant relief, that's because you probably need someone to loosen up specifically on those tight muscles on the hip, or even from the hip to the knee, the hamstring, the IT band, the hip flexor, the gluteus muscle groups needs to be loosened up first before you can enjoy the result. But for sure, those stretching and learning how to move will help you if you have this kind of diagnosis. Right? Thank you very much for watching today. Hope to see you soon. Bye.